Hello and welcome to today's webinar Wednesday, Developing Family Resource Center Networks. Where do we start? So glad you have joined us today. My name is Jennifer Green and I will be your presenter for today's webinar. If you are joining us online via your computer audio speakers, you can listen in directly through your speakers there. If you've joined us via phone number, you can have the information provided from Zoom. For those of you who are joining us online via the Zoom conference, if you can check out the chat, we've added all of the handouts for today's presentation there for your convenience. In addition to that, you can use the Q&A section for today's webinar. We'll get to all of the questions at the end of today's presentation. But throughout the presentation, feel free to use that chat feature as I'll be monitoring as we go along and can engage in conversations. Thanks, Wanda, for starting us off there. And if you're having any tech issues, we do have our live tech support on with us today, Cheryl. So you can private message the NFSN Tech on the participant list there, and she can assist you. Thanks, Gabriella, as well. I will try to get to all of our questions at the end of today's presentation, and if for some reason I'm not able to, we will follow up after the presentation today. Like I said, today's PowerPoint, the handouts, everything is listed in the Dropbox link that is in the chat there. We'll add it at the end of the presentation as well. And last but not least, when you exit the webinar today, please take a minute to fill out the evaluation. We do read through all of the responses and value the feedback as you are participating in today's webinar. So let's get started. As I mentioned, my name is Jennifer Green. I am the Senior Manager of Membership and Events for the National Family Support Network, and super honored to be here in this space with you today. So let's kick off with a poll to start us off, and everybody can understand who's in the room with us. So where are you joining us from? Take a look at this map. Are you joining us from the Northeast, the South, Midwest, West, Canada, or other international? And if you do select the other option, if you can put your response into the chat, that will be very helpful. Thank you guys for filling out this poll real quick. We'll give you a few more seconds to select your option. All right, let's go ahead and close that poll and figure out who is in this room today. Wonderful. So we do have a Canadian participant with us today. Great to see. Pretty even split across the Northeast, South, and Midwest, and a smaller group from the West Side. Well, thank you all for being here today. We're going to launch one more poll here. You can take a second, fill out the second poll. So we know where you're from. Now let's talk about your affiliation. If you can launch the second poll there, select what is your affiliation. Do you represent a family resource center, a family resource center network, any other type of family support program? Are you in education, a government, either child welfare or other? If you represent an other, please add that to the chat as well. I'm monitoring over there and that'll help me. Any private funders or other, anything we've missed? It's a long list, but if we've missed somebody, add it to the chat and we can see that as well. All right, 2 more seconds for that and we can close out that poll. Thank you guys for filling this out. All right, let's see those results. What is your affiliation? Wow, we are all over today. Okay, so I see some others. Thank you for filling out the chat there. All right, well represented across individual FRCs. We have FRC networks. We have other family support programs. If you selected that other family support program, will you add that to the chat as well? I see some education, some government child welfare, other government. I see nonprofit organization Boys and Girls Club with us today, the State Fatherhood Council. Thank you, Anne. A parent-child center. Okay, so in your state, you may call it a parent-child center. We know that in some states, they recognize family resource centers as parent-child centers. Nonprofit, they're called Families in Action, and Early Childhood Council. Wonderful. Well, thank you all for filling out the polls there. Let's talk through where are we going today. This is our roadmap. So you're here for a long journey. We're going to go through family resource centers, dive into family resource center networks. We'll talk about the National Family Support Network. I'll share out the FRC network development continuum. We'll walk through that. I have a case study from Georgia to share with you. We'll dive into the funder continuum, the FRC system development funder continuum, and close out with some events and resources. So as I mentioned before, if you have questions to ask throughout the presentation, feel free to add those questions to the Q&A section on your dashboard. All right. Hello, everybody. I'm so glad. I love to see the chat blowing up. It's really helpful to see you're engaged. It's a way to engage on these webinars. So thanks so much. All right. So our one more poll, last poll, is family resource centers. So family resource centers, there's thousands of family resource centers that have emerged organically across the country, yet their existence is still largely under the radar as America's best kept secret. So it can be either a community or a school-based welcoming hub of support services and opportunities that are designed to support families to be strong and successful. So we're going to launch a poll. Who has heard of a family resource center prior to today's webinar? Does your state have programs that look like family resource centers? And select yes, no, or not sure. All right, we can close that poll. So to your knowledge, does your state have programs that look like family resource centers? I see a lot of yeses. I see a handful of no's and some not sure. All right, so for today, this will be helpful for all of you. So on this slide here, the top image, you can see this is a community-based family resource center that's in Vermont. And on the right-hand side, you can see a school-based FRC that is located in Kentucky. So in one of the schools in Kentucky. So family resource centers, there is actually no dedicated federal funding FRC for funding FRCs like Head Start, home visiting, or after school programs. Yet there are now more than 3,000 of them working with more than 2 million people annually. And so why are so many public and private funders at the state, the county, the city, and community levels choosing to invest in FRCs? And simply put, FRCs are just a good idea. They are cost effective, they're highly adaptable for various communities, be they urban, rural, ethnic, and they have demonstrated successful outcomes through multiple external evaluations. And as conveniently located hubs, they bundle and co-locate many services that may be familiar to you, such as home visiting, evidence-based parenting education, health screening, play groups, fatherhood programs, family counseling, food banks, all of these various services in one convenient space for families. And this research here has come from research that has been done with that's funded by the Robert Wood Johnson Foundation and with a research institute in Colorado. So we worked on them with this despite, FRC's organic development and the varied funding streams across the country. There is remarkable similarity in the most common service areas. So as you can see here on the screen, the 4 items here. So parenting support. So for parenting support, this exists on a continuum, and it's from lighter touch to more intensive services. So lighter touch being that parenting workshops, parenting support groups, having a space for parents to come together, parenting education series using an evidence-based curricula that you may be familiar with, and the most intensive services there being home visiting. So having home visiting services available so the Family Resource Center can then be that that backbone, right? That backbone support for families, that space that they can go to. We also see access to resources, and this common service area is also on a continuous. You can see on the screen there, the lighter touch being there on the left with enhanced information and referral, then going into those concrete supports, that's your basic needs supports, and then working with families over time to address those family identified goals. And with the most intensive touch there being the co-location of resources. So we've seen family resource centers who may have a WIC clinic that's actually in that same space of the Family Resource Center, being more convenient for families. We also see child development activities as another common service area, as well as parent leadership development. And I see in the chat one of our parent leaders that I have worked with in the room with us today. So glad to have you with us, Shantae. And family resource centers not only provide programs, but they build communities of peer support for families to really develop those social connections that reduce isolation and stress, which are highly correlated with the likelihood of child abuse and neglect. So having a space there. And the slides, I see some questions coming up, but the slides will be available at the end of the webinar when we put everything up on the website. Just wanted to get that question answered. So I see that some of you have seen family resource centers in your area, and some of you are unsure, and you may have some clarity now that I've asked that question and shared a little bit more. So now, looking one level up, we're going to talk about family resource centers networks and talk about how they're connected. So not only have cities, counties, and states hit upon the value of FRCs, but they also hit upon the value of networking them together, right? So they don't have to live alone and do this work in their own communities, but the being able to serve as the backbone entity to leverage and coordinate the collective impact of their members, ensuring quality coordinated support for families, and then creating opportunities to build those partnerships, ways to build capacity within the state, and within those various family resource centers, addressing system challenges, what is going on in your state, and being able to develop joint projects together. And the most common functions, this data also came from the Robert Wood Johnson Foundation work with the Omni Institute in Colorado. And what we've seen are these 4 common functions here for family resource center networks. So they, 1, increase the connectedness, the coordination, and the cooperation and collaboration amongst members. So the 4 C's, so being able to work together with those. We also see some networks provide training and technical assistance. So as I'll talk in a bit about the standards of quality, but networks have been able to provide training on the standards of quality within their network, or various other trends or gaps that are needed within the professional development of those family resource centers. So training and technical assistance, some networks work on advocacy, policy, and legislation, being able to help at that systems level, and also providing and maintaining a shared data tracking system, because we know with having that coordinated approach with tracking data, then you can help further move the needle with quality programming and learn what is happening and be able to study that. All right. So networks of FRCs can actually work effectively with child welfare in numerous ways. And 1, by establishing those linkages, right? Leveraging family resource centers in relation to child welfare. And we actually have a Continuum on our website that you can look at these resources as well. You can coordinate with multiple systems. You're promoting that coordinated support for families by involving families in reforming your child welfare in your state, supporting your state Family First Prevention Services Act implementation. We have seen this take place in Illinois. They were actually the first state to leverage their network of FRCs with their what they call family advocacy centers, or FFPSA, the Family First Prevention Services Act. And they can also support state kinship navigation coordination. And we have seen this example in New Hampshire. New Hampshire was actually the first to leverage their network for kinship navigation. All right, so Family Resource Center networks, the way we talk about them is in two different ways. So we talk about the stages of network development. So emerging is that 0 to 3 year mark. You're just getting started. You're determining who's going to be at the table, who are the players, what do you want to focus on, all of the beginning stages of that network. And then as you move on to that 3 to 5 year mark, you're in the evolving stage. That is where you further developed. You may have hired a contractor or a staff to be a part of your network. And the network is really beginning to have more structure and capacity to do more. And then the further you move along is to that established phase. That's the 5 year mark. You typically have staffing, a track record of activities, and an interesting characteristic of these types of networks is that they've weathered a crisis and decided to really stick together. So those are the stages of network development. So moving along that continua. And then the type of networks is another way that we see networks. So we'll start with volunteer coordinated. So volunteer coordinated is led by FRC directors themselves in a voluntary leadership type role with no network staff. So there's no paid staff for this. It's volunteer. It's FRC directors doing all the work that they do to run a center. In addition, they're wearing an additional hat to then coordinate a network. And examples of that is West Virginia. We also have funder coordinated. So funder coordinated could be either led by a public department or a foundation, and they both fund and convene the centers. And so a couple of examples of this is New York and Nevada for funder coordinated. And then the last type of network coordination type is independent nonprofit. So this is staffed by independent nonprofit organizations, and they function as a membership alliance with members that are paying dues. And these networks specifically may raise and distribute those funds, so being that intermediary or not. And so a couple examples here is Colorado as well as Maryland. Check my chat as I'm changing, making sure everybody's following along. All right, great. So the National Family Support Network was co-founded by the 8 state networks of family resource centers represented on this map here. And for the first 4 years, the NFSN had no paid staff, and these members coordinated their work of the National Family Support Network as volunteers on top of their jobs of running their state network. So just like the volunteer coordinated network I had just shared. So they did that for the first 4 years. Whereas now, I love seeing this filled in map here. Over the last decade, the National Family Support Network has quadrupled in size to now have 38 member networks with more, that's 37 states and the District of Columbia, with representing more than 3,000 family resource centers that serve more than 2 million people annually. And the newest member on the map is Louisiana, who just joined us this month. We also have Virginia, who joined us back in April, as well as North Carolina, who joined us in June. So our map is getting filled in green. And if you do not see your state filled in green there, happy to connect with you after this webinar as well. Thanks, Debbie. Yes. at the table in 2011. So the mission of the National Family Support Network is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. And our vision is, simply put, that the map that we just viewed would be fully green, all green, and so that all families would have access to quality family support services in their communities, provided by family resource centers that are supported by strong networks. And the National Family Support Network areas of work you can see on the screen. We have 3 specific areas of work. So connecting and convening member networks to enhance their effectiveness. So we peer share, there's mutual support and various activities. The second area of work that we focus on is promoting family support best practice and evaluation. So we raise awareness of what quality family support looks like. We have the standards of quality, which I'll mention in a bit. The standards of quality. We also have various evaluation with those standards of quality. And the third area of work is raising the visibility of the value and impact of family resource centers and family resource center networks. So being able to share to a broader audience of the quality work that's taking place in networks across the nation, and being able to highlight and share that information. So getting the word out there, such as being on this webinar today. All right, so the standards of quality for family strengthening and support are unique in that this is the first standards in this field that create that common language and expectations across various types of family strengthening and family support programs. And so whereas home visiting programs may have specific standards based on their curricula, these standards create that common language across all types of programs, and they help ensure that families are supported and strengthened. All of the standards of quality tools and resources are all available free. We want the standards to be available to you as a resource to support your quality programming, and they can be downloaded on the website. There's implementation tools and resources there. So check out the website, check out our standards of quality page there. But cost effective because they're totally free and you can download them today. We want them to be available and in everybody's hands. All right, so let's talk membership. So the criteria for starting an NFS or a state network is that 2 or more family resource centers would come together. So at least if you have 2 family resource centers, you have a network. I mentioned those network stages. You can be at any point on the development of your network, and we recognize 1 network per state. So if there are 2 various organizations that would come to us and say we want to be a member, we actually only recognize 1 network per state. So we would look at those organizations working together or entities. Dues, the dues for membership actually cover the whole state. So it doesn't matter if you're like Kentucky and you have 888 family resource centers in all across your state, or if you have 57 centers like New Jersey. The dues cover that whole state. And you can see the price point there for new member dues. Those are a little bit lower as you become a new member, understanding that networks need some time to build and build infrastructure and get their feet wet. So 700 for volunteer coordinated and 1,000 for all others. That includes the whole annual fee there. And then the ongoing member dues, you can see they're listed also. So they go up a couple hundred, but we intentionally lowered the price as you are a new network and building your network. All right, so the Family Resource Center Network Development Continuum. So you're learning how to start an FRC network. This is for non-funder FRC network. So you're looking at, I'm going to walk you through this tool a little bit. So we have the 4 different steps here. So the explore phase, some suggested steps, and some NFSN resources. So we've provided what are some suggested next steps to help you along this journey, and then what are some resources that go along with that. So this tool is available on our website. It's in the handouts folder that was shared earlier. We'll share it at the end as well. But you can also go to our website and click on the Family Resource Center Network tab and get immediate access. So exploring that's the beginning work, right? You're figuring out what's going on in your state, you're reviewing various frameworks, you're participating in webinars like today. How do we get started? You may have participated in the national briefing that was held back in May. And then as you move along to the assessment phase, at that point, you may be developing a survey. The next steps could be conducting that survey, identifying FRCs that are in your state, and also analyzing those results to see where are you going with that information. Then as you move further along to the development phase, that's where your network meetings begin. You have your committee together, you're developing your goals, your mission, your vision, any operating guidelines, who's going to be your leadership, determining who are those players to be at the table. That is when you would join the national network, so becoming a member network and participating in member meetings, as well as our convenings and our annual member convening. And then further along, you get to that operationalize. So you're regularly meeting with your network members. You are conducting your network activities and doing all of the things, advancing your goals and reviewing and refining as needed. So this is for anybody who's trying to start a Family Resource Center network. And I did see a question come up where you can find FRCs in your state to join their network, and that is actually on our members page on the website. So let's pivot over. I'm going to share a case study. We're going to look at the case study from the Family Resource Center network development from Georgia. And the uniqueness of the Georgia network is that they were able to accomplish all of these goals within their first year. And the Georgia network is actually within the Division of Family and Children's Services, which is the Georgia's Children's Trust. It's part of their child welfare system. And exciting to see where they began. So participating, they had heard Andrew Russo, our director, speak at a workshop at the CBCAP meeting, the Community-Based Child Abuse Prevention Grantee Annual Meeting, and they started researching where are family resource centers in Georgia. This wasn't anything structured. It was more just Google searching who's in our state. Then they pivoted and decided to connect with the Prevent Child Abuse chapter and the Strengthening Families initiative that was taking place in their state. And they wanted to share that idea of forming a network and seeking their partnership. They held various calls with Family Resource Center providers that were already found within their state. And then at that point, they decided to develop an actual survey that they would share out with all of the programs. So they got an interest survey to FRCs. They were able to get it into their hands and determine who classified themselves as a family resource center, as well as who's interested in joining a network and coming together. So those were their next steps. They started connecting with us at the national network and actually started with hosting a standards training, bringing all of those folks together, starting with a standards training. They became a part of the National Family Support Network and hosted their first 2 standards trainings there, you can see, in May of 2018. So from August 2017 to May 2018, you see all of the work that took place. They had a $30,000 budget for that development, which included building standard certification trainers and hosting that standard certification training, and then also with the consultant to plan and facilitate those initial network meetings to help them out. And I can say now in the past 4 years, they've dedicated 1.5 million per year for 3 years of their federal, as mentioned earlier, the CB cap funding there. And that was for their first Family Resource Center funding opportunity. And now they've increased their membership from 17 organizations back in 2018 to now have 61 organizations represented. So lots of work is happening. Yes, Georgia's Family Support Network is housed within the Department of Family and Children's Services. Yes. So contact information there if you want to reach out to the champions who have led those efforts. Deborah Chosewood. You can also access her contact information on the Georgia Network profile and snapshot that's on the NFSN website. So look forward if you want to contact them and learn more. All right, well, let's dive into the next continuum here. So this is for funder coordinated. So if you are a funder and looking at a Family Resource Center development continua, there's a couple more steps. So let's talk through looking at the prepare phase. Same setup here. We have suggested next steps that you may take, as well as some resources that can be available for you. So in the prepare phase, same thing, you're talking with funders, you're participating in NFSN events and webinars. You may visit an FRC, and that was the same context for the last continuum as well. You may want to go and check out an FRC. What does the Family Resource Center look like? And so we're happy to connect you with our member networks as well to facilitate those connections and provide any sort of consultation and technical assistance. Then moving into your planning, you're getting all of your planning team together, you're mapping out your plan for Family Resource Center. So what are your community needs? Looking at that community needs assessment. What are the gaps that you all have identified that is gaps in services for families in your communities? And building in the parent voice with that. What does your budget look like? Identifying staff that are also going to monitor your system and developing your requests for proposals. You're designing your data management. What is that going to look like? As well as your evaluation framework, because Family Resource Centers have so many variety of resources and supports available. And so what are you going to measure and look at your evaluation plan? So having that evaluation framework, we have sample Family Resource Center budgets. We have sample requests for proposals as well. So you can reach out and we have those available. We have the procurement phase for this continua for funders, because you would have this additional step here. So you're actually issuing your request for proposals. You have a review process and you're awarding your contracts. So like Georgia had their new Family Resource Centers, awarding those contracts. And then moving into that operational phase, providing standard certification training. So on the standards of quality for family strengthening and support, providing any sort of training and technical assistance for your network, orienting your new Family Resource Centers on your data management systems, and conducting grantee meetings. So having a plan, right? There's so many needs that come up as you are starting Family Resource Centers. And we also have sample resources available for that phase as well. And then the last step here is monitor. So you're developing and using those quality assurance measures. How do you look at your programming across your state and your network? And you're collecting and reviewing and reporting that data, refining any systems. We have the standards of quality participant surveys. We have the program self-assessment, so monitoring that, looking at where are Family Resource Centers on the continua of the standards. So looking a little sample taste of the standards of quality as you're looking at family-centeredness and family strengthening within your programs, diversity, equity, and inclusion, and community strengthening an evaluation. And so you're able to measure and look at that across the various family resource centers in your network. So I have shared a lot of information, and I wanted to pause here and use the chat as a buzz session. So what resonates most with you from the information that I have shared? So not question and answer, but what's sitting with you after listening to all of this? And also, what would you be interested to explore more? So I'm going to open up my chat. I see. All right. Can you give an example of a foundation who has led a funder coordinated network? And I see if you can add that one to the questions box. We'll get to all of those at the end, but what's resonating so far with you? I've shared the various continua that are listed on our website. We have our standards of quality that I've shared. I've talked about the types of networks and what does membership look like. Thanks, Shantae. I love this little bumblebee. What's resonating for you? I shared the Georgia network story, that case study. What's resonating right now? So talking about smaller FRC networks that exist to meet those local community needs, that is a great buzz thought. You know, we talked about the state network coordination and what does it look like to start a family resource center network. So the qualifications there is that you have 2 family resource centers that are coming together, and the NFSN recognizes 1 network per state. And so, yeah, that's what it looks like. I think that there are local community local community family resource centers that are coming together and could do that. So that could be, we've seen this in some states where the county has come together. California is a prime example. They have county coordinated. They also have their state network coordination. And so it looks different state to state, and happy to connect you all with that as well. But then the idea was that those various networks would then come together. So California is a great example there. Thank you. So some great opportunities to partner and collaborate to start a family support center. And the ability to meet families where they are, meaning having a continuum of support so we are not forced to provide more than is needed. Right. Having that continuum of support services, and also ensuring that you're meeting the gap of what is needed, getting that community voice and that parent voice. What is your community saying for what the needs are? And that may pivot, right? Think that it's great that there's essentially only 1 recognized per state, which makes the network so much stronger. Yes, that coordination across the state. Thanks, Cassandra. And New York is a great example. There's the New York City coordinated network there, which we just highlighted in one of our webinar Wednesdays, highlighting the new family enrichment centers, and then what does the state overall look like? And so I'm working with the network as a whole. Great. If a program isn't an FRC but wanted to become one, we would have to collaborate with an already existing family resource center. So, I mean, I think I can give an example of that too. You know, looking at defining what is a family resource center. So I would start there, looking at our document to say, what is a family resource center? That's available on our family resource center website link as well, to really dive in, or what's the criteria of that, and what core services are the common service areas that are being provided. And if they wanted to become an FRC, yeah, there would be some changes taking place and pivoting that's taking place. It depends on what are they currently providing? What does that look like? Thanks, Michelle. I love the importance of making sure families are supported and informed, especially in the challenging times we are in now. Yes, the lovely thing about Family Resource Centers is that it's universal access for families, right? Anybody can come. There's no specific criteria that needs to be met, depending on the state. But the goal is universal access. And so having a space for families to have those supports in place. I know the dream is for like every corner, right? That we have Family Resource Centers. The state network can be a network of networks like in California. Exactly. The opportunity to work with child welfare to provide peer support to youth and families dealing with mental health challenges. Yes. We actually just did, so we see a lot of that with like differential response, and there's a great Continuum on our website as well. So check out the website for the FRC Continua. Follow up with me if you can't find it, but there is a resource on the website for you to see that and how is that graded. Thanks for sharing that thought. And you would like to, Kenya, I hope I'm saying that correctly. I would like to explore more about ways to improve diversity and inclusion at our Family Resource Center. I'm from El Paso, Texas, and we have a big Hispanic community, but we also have one of the biggest military bases right across the border from Juarez, Mexico. So it's been difficult to come with ideas to improve diversity and inclusion. Yes, so check out the standards because there's examples on that, on the standards as well. Examples on what does that look like to improve diversity, equity, and inclusion within your programming. So that is a great resource there. And I'm actually based in Texas, Mia, and used to be with the Texas Family Support Network. So glad you guys have joined. And I know the Family Resource Center in El Paso is up and coming and just started this fiscal year. So congrats on your new funding. You watched the Family Enrichment Centers last week. Love it. Thanks, Cassandra. I'm so glad you're able to watch that. They had some great stories. We had a parent participant who was a parent leader within one of their Family Enrichment Centers sharing her story. So if you have not gone back to watch that, I would encourage you to take the time. It's a great resource. Yes, so many. They have expanded, and they're going to be expanding all those Family Enrichment Centers in New York. So yes, happy to see that. All right. Well, these were some great buzz thoughts. I'm going to keep going and get to some questions as well. I see, Olinda, I see your question as well. All right, so let's talk resources. So the National Family Support Network has a lot of resources, and I mean a lot. Our website is full. I would encourage you to click on all the tabs, check out the Family Resource Center, check out the Resources tab, the Family Resource Center Network tabs. There's, we have FRC overviews, we have research reports. People want to know, what does the data say? So the Omni Institute research that I just shared earlier about those common service areas, the Advancing the Field project. So lots of data, information about data management systems. So check out the website there. We also have all of the member network snapshots. So you can download the full list of the member network snapshots and learn more. Or you can also click on the individual states on that website page and see. You can click on your state if we are already a network. I saw someone had wanted to know, how can I connect to the people in my state? So click on your state, and the window will pop up and share that state-specific snapshot. It has the contact information, it has who they are, what are they, their common service areas, their highlights, what are they working on, and their whole story there, just like this example on the screen, as well as the standards of quality for family strengthening and support. And there is multiple tabs on our website, including the tools, resources, everything that is available. What does implementation look like as well? And how to get access to certification trainings, or maybe you're interested in developing trainers. NFSN services, so things that we do provide is facilitating connections to member networks. I referenced that during those continua. So as you're exploring and learning more, gaining access to member networks, we're happy to make those connections. We can do presentations for any key stakeholders. So if you have your children's trust fund or any funders that you want to do something specific for, we're happy to present for your key stakeholders. We can also provide technical assistance for FRC network development. And so as networks are getting started, we can do some individualized consultation with you there. And we also provide training. So we have the standard certification training that I've mentioned earlier, as well as the developing and sustaining effective parent advisory committee training. We also have a variety of webinar Wednesdays. I believe we are at 28 webinars this whole calendar year. So glad you were able to join us. Our next upcoming webinar Wednesday is on August 3rd, which will go into an overview of the standards of quality that I've been discussing on this webinar as well. But you'll get a deep dive into the exploring those, as well as on August 17th, we have the Uncovering America's Best Kept Secret. So that is solely focused on family resource centers and uncovering these secrets. We also have the standard certification trainings that are offered every fourth Thursday and Friday of each month. The upcoming deadline for this July event, registration is filling up. You can register by the 18th, which is Monday. Get your seat. If not, we can see you at the August event. If those times and those dates don't work as well, we have the opportunity to work with you to provide a specific training in your state. And so at your specific time, if you do not have specific trainers in your state already, so check out the website. We do have trainers in our networks already. So check out to see if there is trainers within your state. And if not, reach out to us so we can work with you to get a training in your area. Right now they're virtual, but in the future we'll be going to an in-person training. We also have the Developing and Sustaining Effective Parent Advisory Committee training. This is unique in that it is solely for staff. It's the only PAC training for staff, focused on staff and building infrastructure to have quality parent advisory committees. And so you may be wanting to start a parent advisory committee or already have one and you're looking at refining and improving it. So this one is unique. It's a virtual training, so you don't have to travel anywhere. You save funds there. And it's actually co-trained with the National Family Support Network staff, as well as a national parent leader. So we hear great feedback. It's great to have folks at the table, as well as encouraging leadership to be a part of that training with you. This is monthly. This is every fourth Tuesday and Wednesday. And we can do the same thing, like I mentioned in the standard certification training. You can contract with us to set up for your network to have a specific, or your state to have, your organization to have a specific training that's on your time and your schedule. So we can work with you to find a date that works best. So visit the website, go to the training section, and you can learn more about the PAC trainings and costs. And I think this is my last resource, but I staffed this, so I'm so excited to be here with you. So the Together for Families Conference, the National Family Support Network co-hosts this event with the Center for the Study of Social Policy, as well as Families Canada. And this conference is the big tent event of bringing together family support and strengthening programs to work together and share best practices. We have Dr. Dana Suskins, who will be with us, who wrote the Parent Nation book, and she's kicking us off. We have Families Ireland, who will be presenting, so we'll have some Irish fun into the conference, as well as our Parent Leader Committee, who's planning and informing. They're fully planning the closing plenary with a real talk with parents. And so we're super excited to have that as our closeout. We have networking opportunities, as well as a variety of tracks focused on parent leadership, advancing diversity, equity, inclusion. We have our systems focus, and then just overall innovation of best practices. So various tracks. Check out the website, but just want to plug the end of this month is the last date for early bird registration. So check out the website. see who the lineup is and check out the agenda and see how you can get connected. Or even if you want to sponsor the event, there's opportunities. But let's pivot to our questions box. I've shared many resources. This has been a conversation. I saw some questions come up in the chat, so if you can for sure make sure your questions made it to the Q&A panel, and we'll get to our questions. All right. Liz, I did answer your question about PAC training. So yes, check out the website or reach out if you want to coordinate one for your New Hampshire network. One wonderful training that has helped our Family Resource Center to improve diversity and inclusion is creating a parent advisory committee. Great, so you were able to then implement. That's wonderful. And that's sort of a next step for some states or organizations or family resource centers, is that they maybe participate in the standards of quality training and learn about the standards, and maybe they start implementing. And then that next step is the parent advisory committee training. So glad you were able to take advantage of that resource, Estella. Finding a list of the family resource centers in our state. So Olinda, I would reach out to the point of contact in your state. The National Family Support Network looks at all of this. We manage the membership of state networks. And then, so we would encourage you to reach out to your point of contact for your state to get either a list or connected to any family resource centers in your state. That's if they are members. So if you can check out the website, go to the members tab, and you can click on the state, and that contact information will pop up for you for who should you contact. Thank you for the question. Wonderful. And where do you find FRCs in our state to join their network? I think same question would be reaching out to your state point of contact to be able to join with them. All right, thanks Kimberly for this question. I see one more Q&A question. So I have, can you give an example of a foundation who has led a funder coordinated network? A foundation who has led a funder coordinated network. Let me pull up my sheet just to make sure I'm speaking correctly while I answer my second question. So how can you become an FRC if you're a nonprofit organization? The Boys and Girls Club would love to become an FRC in the Newark area as we serve many families in our community through partnership. It seems as though we would need to collaborate with another FRC. Can you clarify the steps we would need to take? Thanks for that question, Kimberly. So if you go to, I just looked at this. So I know that in California, some of their focus there is either maybe a YMCA or a Boys and Girls Club there. And they're all connected as well because they're essentially with similar programming, right? Good look there. Clarify steps. It seems as though we would need to collaborate with another FRC. And Kimberly, will you confirm which state you are in as well? That would be really helpful. Thanks, Debbie, for confirming. Okay, New Jersey. Yeah. So New Jersey's current state. I would look at they have their centers across, and there's actually a webinar on our website too. So I would encourage you to watch that and learn more information on what's happening in New Jersey, because your state is actually a member already, and so coordinating with your state network in addition. So I would encourage that as one of your next steps. But it seems as though we need to collaborate with another FRC. Yeah. So you guys already have a family resource center network within your state. So I would reach out to Janira, who is located there in New Jersey. Great, thanks, Kimberly. All right. So I think, Kim, I'm going to get to your question too about a foundation who's led a funder coordinated network. So the New Hampshire network has worked with their children's trust to be able to have their network, as well as let's see who else has a nonprofit. A lot of our funder coordinated we find is within the State Department or in their government, within that government agency. But I would say their state, as well as Massachusetts, would be another great point of contact for you to reach out to, or take a look at their profile. Great question. All right, wonderful. Glad I was able to answer. All right, and then Nikki, Renew, FRC, Hammond, Louisiana. All right, so Louisiana just joined the National Family Support Network, so we're so excited to have Louisiana on the map. And Sheila Lecty, who is the president of Louisiana FRC Network there, she would be a great contact to reach out to. And glad to see you're the Kinship Outreach Coordinator there. All right, I don't see any additional questions here. Am I missing anything from the Q&A portion? As mentioned before, all of the handouts will be available. I'll save the PDF of this presentation so you can access, and it should be up on the website within this time tomorrow. Great questions. I'm just looking at the chat. If I did miss your question, feel free to add it to the Q&A portion. That was on. All right, I think I got them all. Wonderful. Well, next steps for you all, I encourage you to take a look at those continua, see where you at in the process. Reach out if you have questions. I'll be looking at all of the feedback and evaluations to see how can we connect in the future, and take your words and your thoughts sincerely as we inform these future webinars. If there's future topics to include, we appreciate you taking the time to fill that out. I did see one more question come through. Your network started as volunteer, just changed status. Yes, thanks, Liz. So the Children's Trust is now getting the funded. Thank you so much for sharing your information here. Yes, Liz is a newbie. She's got 1 month on her belt now, and we're so excited for New Hampshire for the shift from going from that volunteer coordinated status to being funded and having staffing to be able to further the work. Wonderful. All right. Well, that is all I have for today. So thank you for taking the time to fill out the survey. It'll pop up after this webinar. And I look forward to seeing you on future webinars and in future trainings. Have a great Wednesday and a great rest of your week. Bye.